Ladies and gentlemen, once again, Dr. George Delclos.
Hi, everybody. Welcome back. I hope you're enjoying the conference so far. There's much more ahead, so stay with us. Right now, I'd like to introduce our first moderator, Dr. Newman, who is Distinguished University Professor and Center Director for the Center for Health, Work, and Environment at the Colorado School of Public Health at the University of Colorado Anschutz Medical Campus. This first plenary session is entitled The Expanded Focus of Research and Training in Occupational Safety and Health. Lee will introduce us to the panel of 4 invited speakers, but don't forget there will be a live Q&A session at the end, so send in your questions during the session, and we'll have around 30 or 40 minutes to answer as many of them as we can. So Lee, it's all yours.
Thank you, George, for that kind introduction. Here we go. We are in the future now. Things over the last 2 years have accelerated like never before. Changes in the nature of work have accelerated. And now we need to face up to the fact that in the future, we have to be modifying the way that we do research, the way that we train occupational health and safety professionals, and try to get out in front of this acceleration of the existential forces that are already driving worker health, safety, and well-being to change. We're going to have a session today, which I think is incredibly exciting. We have 4 wonderful speakers lined up who are all helping us triangulate on this complex set of issues of how we're going to be able to do the research and the training of future professionals. So with us today, we have Dr. Laura Linnan. We have with us, after that, Dr. Marcela Tamayo, then Mwangi Ndonga, and finally, Cecilia Sorensen. And I think that what you'll find is that we're going to have a rich discussion with each of them giving a brief presentation of their perspective on this question. And then the dialogue that we have, I think, is going to be particularly interesting as we develop an approach collectively to meeting the future needs of workers. Thank you for joining us today.
Okay, thanks, Lee. I was really happy to be invited to be part of this great panel. I look forward to sharing some insights from my own work and look forward to the discussion that follows. So without further ado, I'll go ahead and let you know what my approach is. I'm going to reflect on some of the important predictions that are out there in the world about the future of work right now. So much has changed over the last while. And then I'm going to highlight 2 examples from my recent work that I think will help us get into the discussion of what are the implications of the future of work for research and training of occupational safety and health professionals. So NIOSH has invested quite a bit in understanding the future of work, and they've put this diagram together that really highlights that work and the workforce and the workplace all have an interplay on what we will be considering the future of work. I would add an overhang to this that really talks about social, political, and economic factors that impact all 3 of those circles and therefore the future of work. I think that's important, and COVID and the pandemic has brought that to light so clearly that these larger forces all impact work, the workforce, and the workplace. But let's start thinking about the workforce first. So I'm going to talk a little bit about the fact that we know we have an aging workforce, there's increasing diversity, and potentially we have a whole host of workers that are more vulnerable. And what I mean by this, if you look at this particular graphic, you'll notice on the right-hand side that about 25%, the big black dot, 25% of the population by 2024, which is just around the corner, is estimated to be a quarter of the workforce, 70 to 74-year-olds. So we know that another third are going to be 65 to 69. And this is just a couple of years from now that the workforce will be aging. And this is a pretty dramatic change over time. We also know that the labor force is increasingly diverse. And here on the left side, you see by race ethnicity that projected by 2050, we know that 75% of the workforce will be white compared to back in 2010, 81%. So the percentage of folks by race are changing. And we also know by ethnicity. So if you look at this graph, you'll see that the percentage of Hispanic in the workforce is going to be increasing to 30%, really doubling from the 2010 projector. So again, the workforce is becoming increasingly diverse. And I found this to be a really striking graphic. And what I want to highlight here is if you look at the y-axis, that's income. So the higher you go on this graphic, the higher the income. And what you also will notice that the bigger the circle, the more at risk this group of workers are for COVID. And this was a risk score that was put together based on proximity, exposure, and contact with others. And what you'll notice right away is that lower wage workers toward the bottom of this graphic are more likely to be at higher risk. So the bigger the circle, again, bigger risk for COVID. And you'll see that occupations such as retail salespersons, maids, cashiers, taxi drivers, janitors, office clerks are some of the biggest blue circles. These are all non-healthcare related workers. You'll also see that the green dots, which are healthcare workers, also have some of the larger circles as well, especially registered nurses, nursing assistants, and care aides. And they also tend to be lower wage workers. So the takeaway here is lower wage workers are at higher risk of COVID across both healthcare and non-healthcare workers. And a lot of these workers are considered essential workers. And we really believe that in the future workforce, they're going to remain essential and they're going to remain at risk. So workers who keep our society running, an estimated 55 million workers, people like teachers and food manufacturers, truckers, childcare workers, and so on. They often have no sick pay, no paid leave, low wages, limited benefits, and access to healthcare. So they're often also working in the most hazardous conditions. So these changes in our workforce that we have seen through COVID, but we've also been experiences in changing demographics are going to continue to impact our future work. We also know that there's changes in the work and in workplaces that impact future work. So major changes in technology, digital advances, automation, robotics, artificial intelligence, all of these factors have been well documented and are really important considerations that will impact future work. We know that the workplace itself is changing. And one of the things that COVID brought to light is this huge shift in remote work that's happened since COVID for those who were not, perhaps not essential workers, had the flexibility to work remotely. Many, many workers started working remotely. And so this shift alone has brought in dramatic changes. And the interest will be how many of these changes stay versus how many folks will be coming back or having some kind of hybrid work arrangement. There's more on-call workers. There's more non-standard work arrangements, part-time, seasonal, contractual, independent contracts, and so on. There's also a 24/7 business cycle that we can't deny is a change in our workplaces, where globalization is part of the reason for that, but it's also just that our society operates on a 24/7 cycle. People have demanded services and products and deliveries happen on a quicker basis. So work pace and duration has accelerated as well. And we can't deny that that has impact on safety and health. And the blurring of work-family boundaries, that is a spillover effect that we see with the work pace changes and globalization. And there's clearly been a decrease in unionization over the last several decades. So workers are not really organized to really influence as many changes as there were in the past. But what are the implications, at least initially, from some of these changes? Well, what I have here are just a list of questions that I think are compelling questions for future research. Like, what is the impact of worker organizing efforts? Right now, we are in a moment with COVID where workers have some leverage. And so are these newer organizing efforts that happen? What are going to be the implications for safety and health policies and programs and practices? With the increases in non-standard work arrangements, how will these impact the safety and health of workers and the organizational culture and work conditions? What are some new safety and health hazards that we expect to occur with all these rapid changes in work and in the workplace? Will mental health and psychosocial stressors continue to be major work-related hazards? And as remote work continues, what are the spillover effects that we're going to see on safety and health of workers, their families, and the culture? We know that there's differential impact on remote work. There's both pros and cons to having remote work. And are there differences based on different types of workers or different types of workplaces on what the effect of remote work may have? And we also need research to understand the workforce and sector-specific differences in how changes in work in the workplace will be playing out. What will these tech and digital advances, will they leave some workers behind? And how many jobs will be lost or gained through automation and robotics? And does it differ by sector, by types of worker? So I'm going to share with you a study that we've done here in North Carolina called the Prosper Study, to just stimulate some more questions about future of work research. We did this under the context of COVID. It's a collaboration, myself and Linnan Islander French, who's an industrial hygienist here at Carolina and head of our ERC. We convened a very interdisciplinary advisory council with employers and workers and state health departments, occupational health folks, human resources, and so on. And then we did this 2-phase study, and we had to do it in a very condensed period of time due to the funding source from state funds, COVID funds here in the state. But the first phase was a survey, and we surveyed small and medium-sized employers, and then we sent out tailored reports to them based on their responses if they were interested. But the phase 2 is what I'm going to talk about here, which is this feasibility study of working with 4 specific small employers and from diverse sectors to try out a total worker health approach to working with them. The feasibility study really started with this assessment of the business partnership, eligibility, having a Zoom call with key contacts at the organization, and an initial visit that include a walkthrough, surface testing, ventilation testing, and interviews with employees. And this happened all around the time that the virus is really evolving. So there was a lot of new information coming out on a daily basis. This was before vaccines were available. So the initial visit took about 4 hours. Then we had an action planning meeting with the employer and some of the employees we talked with to really figure out the best approach to working with that company. It was very tailored to their company. We asked them to implement the prioritized programs and policies based on what they could accommodate at that time. And then we did a follow-up interview to say, was this a feasible approach? So I'm not going to go through all these. You can read through the quotes, but there were some really wonderful quotes about the benefits of having a study like Prosper take place during this time. People had so many concerns, and we were able to go in and really, in an intense period of time, give them really specific information that was helpful to them. They also really liked the total worker health approach specifically, and how it really considered the whole worker, and that workers today really expect employers to have more of a total worker health approach, although they didn't have that understanding prior to our study of what that really meant. They liked it. And then the impact, we think, was quite favorable. They liked having the partnership with us at Carolina, and with this very, very interdisciplinary team that we brought to them with the expertise in a lot of different areas. And then the final answer was this approach feasible? And really, we rated this on several characteristics of feasibility studies from Bowen et al. And the answer was a resounding yes, that there was demand, it was practical, and it was acceptable. So what additional research questions or implications did we learn based on this work? One, that team science really works. We really benefited from having the expertise that we had. That it's important to understand different ways of engaging with managers and employees, as well as thinking about the impact of the work. And important measurement considerations came up on what does well-being really mean, and how can we convey that to employers in a way that's really helpful to them, and what are some really tangible productivity measures we can use. We also learned that we need design options that will really allow for nimble testing, so that we can be done quickly, as opposed to like large randomized controlled trials that take a long time to get the answer and then don't always get the answer you're hoping for. And then essential to find sustainable approaches, particularly for small and medium-sized workplaces. Now I'm going to shift a little bit and talk about training. And we know that the implications for future of work on training are real. And I like this quote from the World Bank that really took into consideration that the future of work, we're talking about jobs that don't even exist today. And what are the implications of that? And one of the things they came down to is to really think about the fact that we need to be lifelong learners. And for so many of the skill sets that we need in the future. And with that in mind, what we have done is the second example I'm sharing is a graduate certificate program that we developed here at UNC on total worker health. And you could see in the bottom left here that this certificate really grew out of an effort that was done by NIOSH to bring experts together and establish some competencies for total worker health. And that appears here in Table 1, where you see these 6 competencies: subject matter expertise, advocacy engagement, program planning, communication dissemination, leadership and management, and partnership building. Those were the competencies. We built a certificate around it by bringing together another national committee of experts to review all aspects of our program. And what emerged was a 3-course, 9-credit graduate certificate program. We've now implemented this program for the last 3 years. We've been continuously updating it since COVID hit. Pretty much everything has changed in the content area, but the structure has remained the same up until this point. We're very pleased to be housed within the Education Research Center, Ex4OSH, here at UNC, and lives within the School of Public Health. So our graduate students can pursue this graduate certificate. The first course is on critical issues in worker health and the workplace, where work is the social determinant of health. We introduce them to all the many disciplines that might be involved in total worker health and the history of laws, regulations, and policies related to occupational safety and health. We also focus on measurement issues. In the second course, it's all about not just measurement at the individual level, but at the organizational level, and then looking at surveillance data that's out there. They get really comfortable with using data, and also how to engage with workers, managers, supervisors, and other top leaders with the data that they have to bring to bear to think about worker safety and health. And then in course 3, we work with actual employers, and we actually teach our students to identify evidence-based interventions, adapt approaches to different workplaces and workforces, think about process and outcome evaluation and communications planning, and then work directly to pitch the idea back to the employer and make final recommendations on sort of a consultant basis with employers. So far, it's worked beautifully. Our employers have been really happy with this approach. So what are the implications for training future occupational safety and health professionals based on what we've learned from our graduate certificate program in total worker health? Well, first of all, we need to create a demand for this type of training. People don't really know about total worker health yet, but we do know that this is training that's really valuable to our students. They're getting wonderful jobs when they finish the certificate program. So we're going to need to educate folks about what it means and create that demand. We also need to figure out who's going to be teaching and who will evaluate these programs. And do we need some kind of certification once people complete total worker health training? Second, we want to establish partnerships with labor and with employer groups to identify just-in-time training opportunities they may need. We know that if we can fill a need, there we will create more demand. And so this is another great strategy. We want to move beyond traditional academic degree programs. So this is a certificate program for degree-seeking students, but we know we need to go past that if we want to identify and recruit health professionals that are not interested in seeking a degree, such as through continuing education programs, pre-post conference workshops, professional meetings, and other opportunities. Additional training might be in considerations. We need to engage with workers, employers, and prospective students to co-create learning opportunities. We have really learned a lot from our students and in terms of what they need and what they appreciate in the learning environment. And we know when we work with workers and employers, we will learn more. So that's going to be critical. We want to be conducting research on best pedagogical approaches and their effectiveness. There's lots of great research that can be done on the different types and methods of training that we offer to really find out what's the best approach. Is it online versus in-person or some kind of hybrid? Do we want real-world employers or case studies or simulations? We can test that, and there'll be great research opportunities for us. And then finally, sector-specific and worker-specific differences must be acknowledged whenever we do any of these kinds of coursework. So with that, I thank you for your attention. I want to thank you again for allowing me to be part of this panel. And I think we're going to be turning it over now to Marcela.
Thank you, Laura. And I am very happy to be here. I would like to start by thanking the conference organizers, and in particular, Dr. Lee Newman, for inviting me to be here with you today. And I will talk to you about occupational health research and training in Mexico. Mexico is a country of over 120 million inhabitants. And it's interesting because we're a country of contrasts. While you can find cities that would resemble any highly developed country, we can also find very, very poor areas with high inequities. And Mexico is also one of the countries with the highest prevalence of overweight and obesity. And so what's the work situation in Mexico? Almost 54 million people are economically active, and 23.3 million of them are in urban cities. However, almost 57% of workers are informal workers. And this means that they are not registered in the IRS. They do not, so they don't pay taxes. And also they don't have any health system to take care of them. Also, 41% of women work, whereas 74.3% of men work. And so, as I was saying, Mexico has several health services available for their population. And one of them is the Mexican Social Security Institute, which is where I work. We insure all private sector workers, which means almost 20 million persons, insured workers. And only IMSS is huge. It's one of the biggest health systems in Latin America. And we employ 468,000 persons already. What benefits do we award? So IMSS provides health services in hospitals, pharmacies, hospitalization, and everything that has to do with health. But we also provide subsidies and short-term disability claims. So we provide compensation and pensions for all our workers, which makes us the biggest health insurance company practically in all Latin America. And these fees are determined by the work activity, the risks at the work, and also the rates of work injuries and occupational diseases that are at work. So this provides us with a lot of data, both medical and financial in terms of subsidies. But let's look at what the situation of occupational health research and training is in Mexico. And as you can see on the screen and with the numbers, I think we're very short numbered in terms of how many occupational health specialists, both physicians and epidemiologists, are available for a country of 120 million persons. And also training in occupational epidemiology is very scarce. There are only a few programs in Mexican universities that really train specialists in this area. So just to give you an example, in this huge institution that is IMSS, our research unit is composed of 3 researchers, and so I think that we have plenty of research opportunities using both administrative data, as I had mentioned before, using short-term disability claims, but also we have a possibility of establishing cohorts that will provide nice follow-ups. So one of the opportunities, for example, is the avocado industry. We've done some research with this type of industry because we know that this is an industry that is exposed to many occupational risks, including pesticide exposure and some musculoskeletal diseases. Avocado production is one of the biggest enterprises in Mexico. And although some companies are registered and have good occupational health practices, it is not uncommon to see this type of work in the field. Many of the avocado workers are temporary workers, and they migrate. So it is hard to follow them. It is hard to track their exposures. And as you can see, this is not uncommon. They don't use any protection. And very frequently, their warehouses will look like this, and it wouldn't be uncommon to find them drinking out of a bottle of pesticides. And I think that this has been shown in many other studies around the world. Another important occupational health risk in Mexico is lead exposure. And this is a problem that actually links occupational and population exposure. This is an example of a workshop of an indigenous artisan ceramic workshop. Their kilns are ceramic cylinders that they make by themselves. The artisan will make it themselves, and they will use lead oxide, which is just the powder that they can buy in any shop in the community, mix it with water with their bare hands, and then glaze the ceramics. So this type of production has been taking place for centuries. It hasn't changed a lot. And the problem is that these kilns will fire at a very low temperature. And it's a perfect technology. Lead is a perfect technology for these kilns, since it melts at very low temperatures and it gives a perfect finish. As you can see, the spaces of work and living spaces in a traditional potter's house are shared. So children might be crawling everywhere, and a woman is mostly in charge of glazing. So they might be glazing at the same time that they're feeding or their family. Unfortunately, or fortunately, this type of ceramics are very popular in Mexico. They're part of our cultural identity, and it's been very hard to tackle this population-based exposure. As you can see in the pictures on the bottom of your screen, these dishes are used to serve food that will be served and sold to just anybody in Mexico. And the problem is that with every use, especially with acidic food, lead will leach out of the pot, and you just eat it. And a very recent study showed that the prevalence of lead intoxication in Mexico, this means with children between 1 and 4 years old, with blood lead levels above 5 micrograms per deciliter, is about 17.4% in Mexico. And in the green bars, you can see the percentage of people that reported using this type of pottery. So again, it's a question of where occupational exposures will also overlap with population risks. So what are many of the challenges and the next steps that I see from my place, from EAMS? So we have a lot of work to link research to operational day-to-day in occupational health. There's a problem with all the databases, like we have so many data that is being collected, but it's frequently not electronic. So we don't have an electronic health record, or we might have only a part of it, but then the work is not really linked to this. So that's a big step to look forward to, to link all these databases and to be able to have access to them. We are also working on 4 laboratories that exist, but they need update. So EAMS has these laboratories that we are looking forward to work with in the next year. Probably we're refurbishing them and re-equipping them with better technology. And of course, we have a very important access to collaboration with private companies. And here, private companies that are small can be more challenging because, of course, if we detect any higher exposure or any risk, this could mean potentially that they could be paying more for their insurance. So we have to be careful with that. But of course, this is an important area to research. And then another important challenge is, how do you do research or interventions when you try to reach millions of them? You know, so EAMS has their own prevention program, but it cannot reach so many workers. So we're thinking maybe in terms of mHealth and trying to implement this in the country where, as I began saying, there's so many high differences in economic status and with formal and informal workers. So I think that can be a very, very important challenge for us researchers and training in Mexico. And also, very importantly, we don't have a lot of funding available. Mexican agencies have very limited funding. And then we're looking forward, of course, to collaborating with foreign training institutions. So thank you very much. I hope this is my email, and I'm happy to take any questions and to be in contact with you. And I will now pass it on to Mwangi Ndonga. Thank you.
Thank you, Marcela, for that kind introduction. I'm so excited to be here. My name is Mwangi Ndonga. I am a product of Lee Newman and the MAP ERC. And like I always say, I can never say no to Lee. And so I'm really excited to be in this panel. And I'd like to talk to you for a short while about big data and my journey through this big data or small data thing, and how myself as an industrial hygienist landed in this sea of technology. And so what I'm interested in talking to you about today is how I can get a seat at this big and small data table. So let's get going. So at my last company, when I started, we had 5 industrial hygienists for the US and Canada. And after a few years, I ended up being the only one. And what I realized was I couldn't continue to do industrial hygiene the way I was doing. In other words, there was no way I can travel to several states or other provinces and be with workers and hang pumps on them. And I just knew something had to change. And so I was in the hallway and I heard some geologists and some other engineers talking about these terms I never heard of: big data, data warehouse, things like that. And I started inquiring, okay, what does that mean? How does that tie to your work? And I got jealous because they were using these tools that were helping them make decisions, make good decisions. And they were also using tools that were collecting data for them, while they were sleeping or over the weekend. And they were collaborating with IT professionals, and they were talking statistics. And I said, my goodness, where have I been? I didn't know this was going on. Why wasn't invited to the table? And surely I felt I have a more noble profession. I'm trying to protect workers. So anyway, I started conversations with these folks, and I found out, there are people called data scientists at my organization. Never heard of that term before. So I asked more and more questions. And this is where I started realizing that I was not in the conversation. I think many of us are not in the conversation. And now we need to either knock on the door or break it down and say, we belong here, right? And let's figure out what we can do with this big data stuff. So I'd like to kick it off by giving just a quick definition from a data scientist friend of mine about what big data is. And so LaRosse, my friend, said, big data is the field of dealing with data sets that are so large that they can't be analyzed in the traditional way. So think about a very large Excel file, let's say with 1 million rows. I mean, you can't sit there and scroll through that or 50 columns. There's no way your mind can wrap itself around that. And so to extract information from big data, right? Our manual and traditional methodology, creating a pie chart off of that data, it's just not going to work, right? On top of that, there can be a mixture of this data. So they can be structured or unstructured. So that could be neat tables where you have CSV files, but you can also have pictures and videos and all kinds of stuff. So you may not be able to process these data the same way you used to. But so we've talked about the contents, but here's the other thing. So we're not just talking about one large file. We're talking about one large file every day, every 5 minutes, every 10 minutes. So the volume and this velocity of this big data, again, we just not going to be, we can't handle this stuff the way we're used to. And so I wondered, what does that mean for me and what I know? So I took a look back and I thought about what does big data mean to our personal lives, right? Truly. For me, for all of us, what we see is this stuff is arriving at our fingertips and our ears and eyes through these IoT devices, Internet of Things. And so these are, you see on the picture of the right, so these are devices, right, that are communicating over the internet, and they're with the purpose of informing us, alarm clock, your heart rate, etc. But the truth is, in our personal life, this doesn't seem so big because it comes so easily, or so it's so efficient. So it doesn't seem as big, as burdensome as a large Excel file with a bunch of, let's say, monitor data from workers, right? And so these folks have done a very good job of making sure that we can consume this easily and probably be addicted to it as well. So the question becomes, do you have big data at your workplace? And this can be a mixture of things like, especially if you have real-time sensors, I'm sure you're getting a lot of information, again, depending on how you're downloading it. So, and do you have GPS locations? Because lots of sensors now are getting GPS locations. Process data. So it's not just about your data that you're collecting. If the idea is I'm an industrial hygienist and I care about how my workers interacting with the process, perhaps I'm interested in that process data and how fast is that coming? Digital forms, paper forms, incidents, observations, videos, pictures, all of the above. So do you have big data at your workplace? You may not know that. I did not know that until I talked to a database professional or our IT advisor to figure out how this thing even works. So how do we make decisions with big data, right? We know that it's being consumed at a high velocity, right? It's coming at us fast, and we're not there in front of the computer the whole time. So how can this big data help us make decisions and keep up with things as they change while we're sleeping? Because we're not there when these things are changing, right? And then it's huge. So how can we extract the most useful things from that big data, right? How do we update our decision-making parameters? My decision yesterday or a year ago may need to change given new process conditions, right? So we need something that can describe and diagnose and predict and prescribe. And we want to focus on the things that matter. We don't want to just do this for fun. I'm very interested in my workers. So this whole thing about big data has to do with me spending less time in my office or on the desktop and spending more time with those workers. And so what I felt is, we need this thing called machine learning I heard about. So what is it, and how can we use it? So I like to think about simple illustrations, and so I thought I can describe machine learning to you if you haven't heard about it using this fruit basket, right? So let's pretend that I am somebody who's never seen any fruits of any kind ever, and we're going to talk about how we're going to describe bananas, right? And so essentially you'll have a computer, and how do we teach a computer to learn what a banana is? And we're going to talk about two types of learning in which we can arrive at that. So the first one is called supervised learning. And the word supervised is key. So essentially what you do is you give the machine some data around these fruits that you see on the right? So you say, okay, banana is yellow, apples are green or red, et cetera, and you give it that information. And you also have a label there, a column that says this is a banana, this is an apple, this is a kiwi. And you see, you give it to it, and the machine identifies that and maybe creates some patterns. And then eventually what you do is you give it a fruit basket, or you give it that data about the fruit basket, but you hide, this is called a test set, you hide that label that says banana, apple, and you see whether that computer can figure out which of these fruits is a banana. So the reason it's called supervised is you train the computer with the test set, and then you you train the computer with the training set. And then in the test set, you hold something out to see if the computer has learned what you were trying to teach it. And then there's this other thing called unsupervised learning, which I use a lot. So here, what you're doing is you're giving the machine just a bunch of data, right? And you're not telling it what a banana is, but you're waiting for the computer to see if it can start distinguishing and saying, hey, I see a bunch of round stuff, but then there's this spiky thing. I see a bunch of things on, these seem different colors, but they're the same shape. But then I see this yellow, longer cylindrical thingy, right? So the question becomes, in unsupervised learning, is this machine able to distinguish a yellow cylindrical thing from other things, right? It doesn't know it's a fruit basket. And so the question, and the thing about what's interesting about unsupervised learning as opposed to supervised, right, is there really is no way to check, yes or no, or, the algorithm was 80% correct. So there is no true answer. But what I like about unsupervised learning is there's less bias on the computer. And so I'll do things like maybe I have similar exposure groups, and I'll throw it to a computer and say, do you agree with me on this, and how I've arrived at that. So what can a machine learn about your workplace, right? What kind of fruit basket do you have? So I've looked at incident narratives. So here, what I'm talking about is generally when an organization is putting an incident, somebody fell, you put in ladder, et cetera, et cetera. But a person gets to fill in a comment box. Lee was on a ladder on Tuesday and this happened, this happened. So we as human beings tend to go to that comment box to really read the story. And so I think there's some things we could do with the narratives, right? That are, or there's some context in that comment box that's not caught elsewhere. I talked about similar exposure groups. So again, I do this once in a while. I'll say, oh, I think these are welders from this plant. This is so-and-so from this plant. And I'll give it to an algorithm to see whether it comes up with the same. Now, it doesn't mean that the algorithm is right, but hey, I don't have any other industrial hygienists with me. I'm by myself, right? So sometimes this is what I do. So process info, this is interesting, right? We always care about what that worker's accessing, the proximity, the environment, et cetera. So whatever, if you're making widgets, what's the throughput? Do you have MOCs, management of change? What's occurring with that? Do you have process disruptions? But here's the thing, and what's happened to me and how I've delivered these presentations is some of this stuff, machine learning may air your dirty laundry. It may show you things that you didn't know you had. It may show you risks that you didn't even know existed. And so you have to come in with, with your eyes open and be ready to hear or see things that you didn't know and be ready to act. So how do you do this? So the picture that you see is me and my friend Kyle. We actually do this podcast for Probability Matters, where we started this podcast because we didn't see an avenue where which we can have honest conversations about some of this intersection between technology and worker safety. And as we started doing that, we started partnering with AIHA National and our Rocky Mount section AIHA. And we started inviting guests. So data scientists, Larry Sloan, the CEO of AIHA, was on there. We interviewed an ethical hacker and she talked about how she ethically hacks, business websites to see how strong they are. And I wondered, can we have EHS hackers to do that and do that with our programs? Anyway, my point here is, I think we need to ask ourselves for a seat at the table. We need to start asking questions, and we need to be each other's advocates, right? So if I'm by myself at my company, how can I connect with you who are listening to this video, the panelists that are going to be here at the end of the day, so we can be a champion for those workers? I really appreciate your time, and I can't wait to hear from the rest of my panelists. And with that, I'd love to introduce Cecilia, who's going to be following me. Thank you.
Hello, it's great to be here today. My name is Cecilia Sorensen, and I'm going to be talking about the future of work under a changing climate. So as we know, climate change is no longer a distant reality. It's a current health emergency, or as some people have put it, a code red for humanity. And so there's so many reasons why climate change is impacting health. And just a few examples are that, air pollution is currently the 5th leading cause of death worldwide, and it's being driven primarily by the burning of fossil fuels, as well as wildfires and high temperatures. Globally, we're seeing that drought and changing weather patterns are affecting people's ability to reliably grow food, resulting in health impacts there. And we're also seeing a spread of vector-borne diseases such as malaria, Lyme disease, dengue, and Zika as the ecologic conditions change, allowing these types of vectors and diseases to come into new habitats where they formerly weren't. We also see that climate change is leading to greater flooding events, as well as coastally and inland, and that is associated with myriad health impacts. And that list kind of goes on. But as we're seeing, there's a plethora of different health impacts that are resulting because of climate change. And so for these reasons, the Lancet has argued that climate change is the biggest global health threat of the 21st century, while at the same time, tackling climate change could be the greatest global health opportunity if we're able to really step in with good public health, with good occupational health measures to prevent associated health impacts. Now, worker populations we know are vulnerable to the negative health impacts of climate change for many different reasons, either due to the nature of their profession, due to pre-existing underlying health conditions, or because of their ability to adapt or the lack of their ability to adapt. We also know that workers are at a higher risk than the general population because they're exposed to environmental conditions that others, like the general public, can elect to avoid, but that they must endure because of the nature of their work. And so for that reason, workers have been referred to as climate canaries because we expect that they will start manifesting health impacts from climate change sooner than the general population will. So just for some examples, the frequency of weather-related disasters, including hurricanes, flooding, wildfires, is increasing because of climate change. And when this happens, when there's a disaster in an area, most citizens are evacuating, right? They're getting out of there, whereas frontline workers are coming in, first responders, medical workers, law enforcement, engineers, construction workers are going into these areas where they're encountering many different potential hazards, including trauma, electrocutions, exposure to toxic chemicals, contaminated waste, and more. And so they're being exposed to things that most of us are avoiding, making them the canaries in this situation. And as we know with climate change, the frequency of these climate-related disasters is increasing. And so here we're looking at NOAA data over the past 40 years, where we're seeing this pretty sharp rise in droughts and wildfires and flooding and storms. And so the exposures are increasing over time. We also know that workers are disproportionately exposed to degraded air quality, and that is becoming worse under a changing climate. Workers that are affected from this include outdoor workers, as well as agricultural workers, construction workers, delivery workers, and the most vulnerable of these are those who have underlying cardiopulmonary disease or any other type of health condition which air quality can make worse. One of the most prominent populations of workers is wildland firefighters. And there's been some studies on their health as it relates to their profession. But in terms of other workers, there's been much less research. And last but not least, we know that many people, including workers, are being exposed to increased heat. We all know the world is heating up because of climate change. Average temperatures have increased about 1 degree Celsius across the globe. However, it's really the extremes that we've been seeing that are the most concerning for health. So heat is associated with a spectrum of health-related conditions, ranging from heat cramps all the way up to heat stroke, which is the most serious. But along this continuum, as workers are operating in hotter and hotter environments, we know that heat affects their cognition and it affects their reaction time. And so interestingly or concerningly, as we look at the daily distribution of injury claims as it relates to daily maximum and minimum temperatures, we see that they're correlated. So the workers are being affected by heat. And it's resulting in more injuries. And that's because of, delayed reaction times, or, the tools get slippery, or just the conditions are intolerable for us to really operate with ideal cognition in potentially dangerous work environments. In the US, exposure to extreme heat is actually the leading cause of direct weather-related deaths in the US. And it's mostly concerning for workers who are laboring outdoors, so far as what we've seen, especially those who work in agriculture. But there's other worker demographics that we need to think about here. That includes military workers, construction workers, as well as agricultural workers. And especially, the vulnerable ones within those demographics are older workers or those who have underlying cardiac, renal disease, or respiratory disease. So with this changing climate, we know that the threats to workers' health are changing, but that also the nature of work is also changing. And that's altering, how workers are able to have a stable livelihood, the stress on them, as well as potential new exposures as work conditions are changing. So, for example, looking at worker productivity, because of a changing climate, we know that workers are losing productivity. So over the past 20 years, it's estimated that US labor productivity declined by nearly 1.1 billion potential labor hours because of extreme heat. And the particular losses were in the industrial and agricultural sectors. And from this map, we're seeing that a lot of these losses were in the southern regions of the US. we're simultaneously undergoing this energy transition, right? Which is decreasing jobs in certain industries, yet opening them up in others. And so with this, workers must grapple with this transition, which may require new job training, new skills training. It might require them to move, across the country or even to a different country in order to get work. So this can be incredibly disruptive to workers' health and their well-being, especially when we're thinking about total worker health and the future of having a healthy workforce. In the US, there are currently now 5 times as many jobs in solar as in coal mining. And future projections are that the demand for coal will fall while the demand for renewables such as wind and hydro and solar are going to be increasing. And so some workers will be able to adapt to this, but others won't have such an easy time. And so we need to really be thinking about how we're going to help manage this transition for workers to keep people employed, to keep people healthy, and to make sure that they have continuous work. Additionally, we're likely to see new exposures emerge as we create these new green technologies, as well as intensify existing technologies in the pursuit of clean energy. So a lot of resource extraction for the raw materials that go into, for example, batteries involve mining, right? And for things like rare earth metals and lithium. And many of these mining operations take place overseas in environments that have very little regulation or worker health oversight, right? Another consideration is that there's been this emergence of a new industry as a result of climate-related disasters, whereby workers have been being employed sort of in a slightly informal way to chase disasters around and to work on remediation. These are generally pretty low-paid positions, and they're being occupied by potentially undocumented workers or workers who don't have a very strong skill set. So if you just think of sort of the scale of this, just in 2020 alone, there were $22 billion disasters. And the $22 billion really comes from the fact that each disaster resulted in over $1 billion worth of property damage. In total, there was about $176 billion paid by federal and private insurers in order to clean up and to rebuild these disaster areas. And so because of all this money that's being infused into this industry of rebuilding, there's been this rapid expansion in this industry whereby companies are competing for insurance payouts as well as government contracts. And so the labor workforce that's following this is a little bit chaotic, and there aren't good worker oversight in terms of their health in these conditions. And so this disaster business, whether it be chasing disasters in the informal labor sector or through more formal lines of employment, can result in wide-reaching mental health impacts. Being on the front lines of a disaster, whether you're a medical worker or whether you're there kind of cleaning up and seeing, the destruction of what happened, can result in PTSD. It can result in depression and insomnia. And a lot of that has to do with the work conditions and the supports that are or are not put in place. So, for example, there's been some studies looking at wildfires, and we see PTSD rates that are ranging from 10 to 40%. And this is a quite organized and quite formal work sector. We know that younger workers are the highest risk. However, all workers have a risk of depression and insomnia. And even in a well-studied population, we're seeing impacts. And that doesn't even begin to account for all these informal sectors that are arising because of disasters and people moving in to have work around these disasters. So I just gave a lot of examples of the different ways that the climate change is changing our health and therefore our work. So as we look forward to the future of work under a changing climate, the things we need to consider are these changing exposures, these new industries, potentially novel diseases, and especially the vulnerable workers in these conditions. So I look forward to the discussion, and thank you so much for your attention.
I warned you. The future is here, and we've got our work cut out for us. So we're now. The great thing is that we have time for in this next half hour to be answering some of your questions. I'm following them in the chat, and I'll be sharing those. But to kick this off, I think what we might do is come kind of full circle from what what Cece was just presenting, back to what Laura kicked us off with, and start by talking a little bit about the challenges that we're going to have and our potential solutions around the educational objectives. So, we've heard now about that there's a lot of data out there. Marcela, for example, at Eames has just an enormous amount of data that they're not really tapping into because of not having the kind of staffing and experienced people to work with the data. We heard about the need for skill development and lifelong learning from Laura around total worker health, and I think Cece, the Mwangi point about big data and climate and worker health is a point of convergence. So, with that as kind of the quick sum up, my question, I'm going to start with you, Laura, and others chime in. How are we as educators going to wrestle to the ground what we need in terms of data? And knowing how to use the data and use it to our advantage to help workers, and how are we going to also develop the kinds of skills that our trainees are going to need, or that current professionals are going to need? Let me kick it off with you.
Sure, I'll give it a start. I'm really thrilled to be part of this panel because I was sitting here taking notes with all of my colleagues' presentations and realizing that point about lifelong learning, it's us. I mean, we think it's our students. We are us. We are the students as well. And it's so important for us to stay current in what we're doing and be thinking about these kinds of future opportunities. So my takeaway, Lee, from the panel discussion today, I was thinking about our certificate program and how, I think we do a lot in our measurement class on data, but I want to go back to Mwangi's presentation and think more about big data. We have some amazing folks at our university who are working on machine learning and other things, and I haven't really thought about bringing them into the certificate program. So that's one thing. I'm absolutely fascinated by Marcela's work in global because, we have brought in a number of global examples, but I think we need to do more because there's just so much that people can contribute and different ways of thinking, but also different examples of workers and workforce issues. So eager to sort of think about that. But the last presentation by Cece just made me realize that, climate change has got to be front and center. So we've got to figure out a way to weave that into our training program for certain. And, again, thinking about lifelong learning, this is where our current students, but also we as professionals, I think, need to have our mindset that this is part of how we have to look forward and really think about what the exposures are and what types of workers are going to be impacted by these changes. So I hope that's helpful for at least getting us started.
Yeah. What do other people think? The floor is open for other perspectives on this. How are we going to get up to speed educationally?
I would like to say something. I think that, for example, in Mexico, in a country where, as I said, there's so few specialists like that really might have a more specific training. I think it would be so important that our general doctors or general physicians are also trained to, even ask the most basic questions about, hey, what do you do for work? Because whether it's informal or formal, most people work, and especially now with everything that's happening, the pandemic and everything, and all these other exposures like stress. And I think that we might need more training, even at that level, that our records, our medical records can also inform us about that, speaking of our data drives me bananas, Mwangi. I mean, because it's really like sometimes we want to check what the diagnosis is, and it might be really work related, but we cannot link that, unless, for example, if it is certified as a work exposure, we might not be able to track it down, So, I mean, I think that it would be good if we could really expand, I don't know how, like maybe online training for these physicians and like all the systems, the health systems that can really incorporate more occupational health data into our medical records. I mean, and this is maybe going outside only our programs that are more specialized in epidemiology or occupational health as such, right? So I think we could explore that.
So yeah, Cece, you've been very active in broadening the scope of who needs to know about climate change and its impact on human health. And I think Marcela kind of cues you up nicely to probably tell us more about some strategies for how to, we're not going to just do it alone as occupational health professionals.
Right, absolutely. I mean, occupational health has, I think, in the larger world of medicine, has become more on people's minds. I'm just thinking of an example. So I'm an emergency medicine physician by training. I'm not an occupational specialist, but I was working in northern Colorado during the outbreak of COVID. And I didn't know this, but the largest JBS meatpacking factory was just down the street from the hospital. And when COVID started coming to the region, we started getting massive amounts of exposures, of course, from the workers at JBS. And we had a total of, so what I learned from this experience was that they spoke a total of 35 different languages and dialects at this factory alone. We did not have translators that could actually translate this. And it became this huge, I think, eye-opening situation, as well as a crisis in the emergency room and in the hospital, because we were taking care of suddenly so many people from so many different backgrounds. And then that became a question, like, where do you work? And think of it sort of a vital sign is that the pandemic made us start to think about this. Okay, where do you work? Because it makes us start understanding what's your exposure to COVID, but how can we, dovetail on that and say, where do you work? Because that influences your exposure and your potential differential of any different type of disease or illness that you're coming into an emergency room or a primary care office with. So anyway, I just wanted to sort of put that out there. I don't think we think about occupational health enough in general medicine, but that we need to. In regards to education, so we do a lot of work at the Global Consortium on Climate and Health Education in preparing health professionals from all backgrounds to understand the risks of climate change and how it impacts their profession and how it impacts their patients. And we are really focusing now on including not just doctors, but nurses, public health, social workers, occupational therapists, all these different types of health providers who need to have an understanding of exposure science, right? That's kind of what climate is exposures. And that's really similar to, I think, the occupational health approach is, who's the patient, who's the worker, and what are their exposures. So I think there's a similar language there and a similar rhetoric around understanding how the environment impacts health. So I'm very interested in exploring, how we can bring sort of this climate lens to occupational training.
I appreciate that. Mwangi?
Yeah, and Cecilia, as you talk about training too, I think about the worker as well. So, Laura, when you said, we're here learning ourselves, and I think about when I visit with workers, an hour in the conversation, they'll start talking about overtime and the stuff that really matters, the stuff that's really affecting them. And then I think about what type of training we're signing them. The OSHA 30, the OSHA 10 doesn't address that. It doesn't address what Cece's talking about, right? Yet this is what it at heart. And so even for me, I say, am I better off actually training this worker on what Cece just presented than my corporate people? Okay, because I feel they can give me more input regarding what's going on at their workplace, what's going on, around themselves versus, me presenting at a corporate meeting and said, hey, we should do this. There's climate change. Yeah, let's have a meeting about that. And another meeting about that. When I can actually, and let's be honest, we sometimes assume, we have to make it really simple for the workers and things like that. No, these are intelligent people, right? And they will all understand anything we just presented right now. And I've come to feel that their feedback has become more valuable. And they ask better questions. They really do. And so it challenges me when I walk away from that workplace. So for me, training, I come back and I say, can we do better training for our workers? Because right now, again, what they are learning about, I know we have to do it. It's the law, but is it effective? I don't know. In many cases, I don't think so.
Yeah, I think it's a great comment. And it also circles back for those of you who heard Laura Punnet's presentation, which I thought was just brilliant. this need for us to be involving the workers, and in them designing the training, them understanding better than we do what their needs often are. So I really value that comment. I want to go to some of the questions related to education that have been coming in, and one from Sarah Felkner was directed to Laura, but others may have a comment. Thank you for a great presentation. What are your thoughts about strategies for creating demand for advanced total worker health training at the employer level? One way to drive demand for training in a particular discipline is to create a career path that employers will embrace. And Mwangi, you've been working in industry for a while now. You may have a perspective on that too, but let me pitch it back to Laura first.
Yeah, I think it's a push and pull. I think, looking at training, we have to be useful to business and employers and decision makers. We have to have something that's pragmatic and helpful to them. When we see the kind of data on climate that Cece just presented, I think it gets people's attention. But I'm also really persuaded by Mwangi's last point about the workers, because when we work with workers, I think we're in a moment right now with the Great Resignation and with, workers have some leverage right now. And they're demanding things in the workplace that they haven't been demanding before, or they're going to leave. So I think it's an opportunity to really engage workers in these dialogues about what they need. We do things like train folks in how to engage in photo voice, which is taking images of exposures at work and then for the purpose of action, not just for taking the pictures, but for the purposes of action. So we're looking at methods for engaging workers all the time in these dialogues with their employers. So I'm not sure if it's going to really answer your question, but I don't think we can just rely on like employers to be demanding this. I think we're going to have some education about the real value of total worker health kind of approaches. And by that, I mean looking at the whole worker and the work conditions in the workplace. And to the extent that this is going to be impacting worker health, and then, obviously costs of doing business, cost of doing the education, and then the value proposition. So I do think there has to be a value proposition. And I think the interdisciplinary nature of what we're doing is really, really important too, because we need people from different disciplines being able to understand the value. And I don't think we're there yet. I think we're just in the infancy, honestly. I think the people who are attending a conference like this know a lot about these holistic approaches, but so many people don't yet. And so we have to go almost on a campaign to get people to be aware of the value of doing these kinds of approaches. And I think with COVID and mental health, this seems to be a real lightning rod issue. Climate change may be another one where we have a moment to really have this dialogue. So I hope that at least starts the conversation about this.
Yeah, and I think that's those are important. Those are important points for people to hear. The one thing I'll just a comment. As you know, we also have a certificate program at the University of Colorado, and we compare notes. Natalie Schwaka, you and I, which has been wonderful because we're learning from each other as we go. One of the things that we built into our certificate program was a 3-credit-hour course on public health communication, because we realized that what keeps coming up in each of the presentations we heard is that we have to figure out how to get a seat at the table. Well, Mwangi, that's actually a communication challenge as much as it is a do I know how to handle data challenge. For the understanding how to talk about climate change, when you have a community that's resistant to even using those words and they'll tune out when they hear that, we're finding that we have to talk about drought and its effect on mental health in an agricultural community, because if we say climate change, they may shut off. So communications, I think, is going to end up being kind of a critical skill. I'm not going to use soft skill because I think it's more rigorous than that. We should stop talking that way. But
but I want to add that to the conversation as we move forward as educators. Let's shift gears though a little bit, and now talk about what do we need to do if we are going to let's make a wedge away from the pure education piece to how do we educate researchers to do the kind of research that we're going to need to handle the future of work. So there was a comment and a question in the chat talking about that adding the courses to a master's degree, that you need to have the basic competence in managing big data would probably be more than you can fit into your average occupational safety and health training program. And Mwangi, you came out of a very fine industrial hygiene program. Maybe you have a perspective on, what's it going to take for us to position future researchers to tackle the questions going forward.
It's a good question, Lee, because you can't, if you have a 2-year master's, you can't just keep adding classes. It's not fair. It's not, may not be right. But what's the exercise? So, do you survey professionals and you say, well, you took this 2nd-year statistics course or something like that. Did it help you? You can gather data like, things like that. But also, I think for me, sometimes in my seat where I am is maybe asking myself, how far do I need to go before I make the call on we need a control or we don't need a control, right? Do I need to have the fanciest equipment to have this lower, limited detection? So I think part of my thing has been maybe a little bit of it's not an anxiety, but maybe shedding a little bit of, I don't need to do research to this depth before I make that call, especially after I talk to that worker, who may sway me a certain way. So I think you see that in the AI space, right? When you have models and you say, okay, it's 80% good enough for this thing, cool, let's go. But in this situation, that's not good enough. So maybe it's a training with, maybe some ambiguity in there with when it comes to classes and saying, well, you don't have a perfect model, you don't have a textbook with you, or the textbook doesn't fit this definition. What do we do? Because I'm sure everybody on this panel and everybody listening in faces that continuously. And that's when I end up calling my former alumni and saying, hey, so this is what's happening. What do you think?
Yeah, just maybe to go off that a little bit. I mean, I think the world has just become so complicated that we're at this point where, we can't all be experts in everything, and we sort of have to accept that. Yet at the same time, we need to have at least an operational understanding of so many different things. We need to be sensitized to, okay, this is an issue. Okay, earmark in my mind here. Big data is a tool that can help. I know a scaffolding of what big data is, when it can be deployed, although I don't know how to do it myself. I know when I need to use it. I know when I need to call an expert. It's something I do every day as an ER doctor, right? I'm like, okay, this is a really complex arrhythmia. I'm calling a cardiologist, and so we need to get in the practice of decreasing the barriers to just calling each other and asking for a consult, right? I mean, we do it often in medicine, and I think that we need to sort of start doing it more, even like in the occupational space, right? Because we can't all be experts in this moment, and so as that relates to education, I think it's really providing graduates with as broad a knowledge set as they can. I mean, of course, they need specific tools, but they also need to be broad, because as we just described, I mean, all these great presentations, it's like the future is so huge, so unknown, and rapidly changing. And what a student learns today and graduates with is probably nothing like what they're going to be doing in 10 years. And so maybe the best thing we can give them is a really broad understanding of the state of the world and what is even out there, to launch them into that world. Just a thought.
I would love to pick up on that, because we struggle with that, and I'm sure Lee did too in the certificate program he put together. Is just so we ended up in the first course really giving them an overview of many different disciplines, because I think the other thing is people don't know each other's discipline at all. So understanding what an occupational epidemiologist does, or an industrial hygienist does, an industrial psychologist, an organizational change person, a health educator. So we introduce them, and we actually have them go and interview people, so they get to really ask some pointed questions and get to know some knowledge level there. But then I think we do another thing. Just recently, we have had what we literally called, Cece, consultants on call. So when we put them in the teams to go and work with the employers, they have consultants who they can call for different areas of expertise. When we were doing the COVID example out in the field, it was when we finally realized it was an aerosol, right? Remember all the debate early on? Was it surface? Was it aerosol? And we were starting with surface and we thought we had it nailed. And then all of a sudden, oh no, so we had to bring in the ventilation folks and the air quality folks. And we had to really be fast about getting that in place and working. So I guess the key takeaway for me is really partnering, understanding how to partner, how to create teams, who to call and when to call them. I think those are really interesting skills that I know I'm personally still learning. Where's that line that you draw? So I think, and that comes from experience. That comes from just working on teams and working on problems. And I think giving folks an opportunity to work through problems is probably one of the better ways to test that.
Can I add on to that?
Yes.
Because I think I was speaking exactly of like the multidisciplinary teams and stuff. I think that very often people are doing research without even noticing that, and when they hear the word research, it gets complicated, and it gets hard. And in people's mind, it's always like, well, I'm not going to be able to publish. So why would I even, So, I mean, I think that also research has to serve several goals, several aims. And it's not only a publication in a peer-reviewed journal, which could be very important and a primary way to get the word out. But I think that also internal reports and just research that, like Mwangi was saying, like the employees can even take for themselves, like they're doing research every day with the work they're doing, and being able to come up with these groups. And I mean, for me, for example, I was just in the first conference, occupational health conference organized here by the occupational health folks, and I realized that they're more hands-on, so they're implementing all the occupational health prevention programs and everything, and they're not doing research, or they think. I think that's a paradigm, right? They are doing research, but we just need to team up and see how this can be translated into benefits for everybody, for the employees, for the employers, and everything that surrounds like having a better health for workers.
Marcela, we talk a lot about, and NIOSH has been a proponent for research to practice, R2P. We've actually taken it full circle, and we've said, well, let's understand how we can harvest what practitioners are gaining out in practice to inform research. So R to P to R, and complete the cycle. There's a lot of opportunity to be learning from what people in the field know, but those of us who may be in an ivory tower do not. I think your point is really well taken. That we are at a time where it's not okay anymore to sit in an ivory tower and publish our papers. I respect it, I value it, I do it, but understanding how we take that into real world application, and that's where the discussion about implementation science is coming in. So that's sort of an almost more comfortable way for, I think, those of us in academia to talk about practice, is to use that kind of terminology. I do, though, want to shift gears to a question that Paul Schulte has asked, and it's for me a slightly terrifying question. So maybe for you it will be as well. Do the panelists think a deeper focus on systems thinking skills and practices can be added to training? And I call it terrifying because I'm not sure that we all would agree on what systems thinking even is. But I'll take the question at face value and see if people have a comment about systems thinking as part of training and about, frankly, our implementation, science, and research. Someone want to try that one?
I don't mind starting. So I've always been a arm's length fan of systems thinking. It's been around from engineering for a long, long time, and I do place value on it because I think, to me, what it speaks to is how most of the issues we deal with are complex, and they're interrelated and they're dynamic. And I appreciate all of that because it's true. The world is messy and we're living in it. So I know these relationships. I think where I get concerned about whether it has to be a fundamental part of how we train folks is where it could be fine for our students, but when we get out into the world of trying to convince employers, and that communication piece, Lee, you were talking about before, and when you're talking to workers, I think they know that fundamentally without having to be trained and go through measurement models on systems thinking, which are very complex, by the way. So for our research folks, yes, absolutely. Could it be guiding frameworks for research? Yes. But when we get out past that, I worry. I worry that we are overcomplicating something that people already know is complicated. And we can use language to talk about things that are systems thinking oriented without putting jargon on it. That's what I worry about. So I'll just throw that out there to get started.
Others have a take on that? I think about it, and then I think about what Marcela was talking about, and I see, in my mind the workers working with lead glazes, and it may be that that in the future we're all going to need to embrace systems thinking, certainly in our research. But as far as here on the ground, if you're on the ground in Jalisco, you're probably just trying to figure out how do I shift to safer glazes. It quickly explodes into a systems thinking problem, though, right? Because as you said, Marcela, it's tied to culture, and we lack the cultural competence. All of us lack the cultural competence to be able to tell you how that problem gets addressed. But it clearly is a bigger social question and psychological question than simply a substitution of safer materials question.
Yeah, absolutely. And I mean, I'm not an expert in systems or engineering, but I think that yeah, I mean, in particular, this problem is something that goes beyond occupational health and research, and it taps into economy, education, culture. So I mean, something as fundamental as lead exposure that impacts the health of everybody. Can really, like you say, it's just a difficult task, difficult to tackle. And I can see how systems and big data could inform that. But yeah, I think that's a big challenge. And with other examples like climate change, what Cici is saying, it's so important that we can really, how do you put everything together, right? So I think that's a big challenge in the very present future.
Thank you for that. So we have just a couple minutes left, and what I promised all of you when you signed up for this panel is that I would come back to you and ask for a 1-minute headline recap of something that you're taking away from this message that you want to make sure that you've shared back with other people after hearing each other here today. So if you can very briefly give us your final word, and Mwangi, I'll start with you.
Yeah, these presentations just came together. And so Cici's presentation for me was just at the summit at the mountain. It just reminded me that I'm here. My job is to help these workers do what they need to do, right, safely. And so it just reminded me again, in whatever effort I'm trying to do and whatever questions we're trying to answer here, ultimately is for their benefit, and that they deserve a seat at our table as well, right? In the research we're doing, or what the initiatives we're building, they absolutely don't just need a seat. They probably need to be at the head of the table. So I'm just encouraged by everybody's presentations, and thank you.
Thanks, Laura. Final thoughts?
Well, this has just been really exciting. I actually feel like I learned a lot, and I also think that my takeaway is probably all kinds of new ideas for how to work with our degree-seeking students, but also we're really interested in doing training of other health professionals and others, just like many of the folks on this panel do. And so really thinking about just in time and all different kinds of methodologies for getting more understanding about total worker health and new opportunities that are out there with the future of work. There's just so many. I'm very optimistic about our research. I think people will continue to do good research on all of these topics. Where I think it's going to be challenging is to really get it right, to be able to convey what we're learning to employers and employees in ways that is accessible to them and pragmatic and helpful. And so that's what my personal challenge is. And that's implementation science. So that's where my heart is. And I think that has been reinforced today with these great panel discussions. So thanks for that.
Great. Thank you, Laura. Marcela, let me turn to you for your takeaways.
Thank you. Well, I learned a lot. And I think that the challenges to this change of paradigm, right? That worker has to be the worker. We should all be healthier when we leave our work. How do we teach that? How do we research that? With big data, with climate change upon us. So how are we going to implement this? That we can really say, yeah, we're healthier after we work. And I think that it might start with work is good for you. So how do we educate on that? How do we do research on that? And I look forward to collaborating with all of you.
Thank you, Marcela. Cece?
Thanks so much. This has been so inspiring just to hear like the breadth of all the emerging ideas and issues there are around worker health. And I'm always also struck by why we call it worker health, because, 75% of the population works. Like, it's just health, we spend most of our lives doing it, and yet we call it worker. But like, I'm a worker. We're all working right now, right? So anyway, that always trips me up because we are all workers. And so kind of driving that home, I think is really what this did for me today. I think it's, we have a huge amount of issues facing our society today and a breadth of issues facing our workers. But what I really see is that there are so many people working in the space with incredible ideas that could be brought together to bear on some of these issues that we're facing. So I'm so honored to be here and to meet all of you. So thank you so much, Lee, for organizing this.
Well, I want to thank all of you for your participation. I also want to do a shout out. I think because the way this is set up, you all couldn't see this very rich conversation that's been happening on the side in the chat, and just a shout out to all of you who asked your questions and have been commenting in the chat in parallel to this discussion. And so, thank you. And again, back to the organizers, NIOSH, the folks at University of Texas, George. This is this whole series that you all have been put together and run over these last several years have been so fruitful in terms of helping to shape our thinking. I'm going to give a shameless plug that next October is the 3rd International Total Worker Health Symposium. It's going to be in Bethesda. And if you haven't already signed up to get information about it or to submit abstracts and proposals, that's all open right now for people to submit their ideas. So I just want to put that on your calendar because it's a logical extension of what we've been talking about here in this conference. And thank you again to George and Sarah and all the organizers of this conference. Turn it back over to you.